right, everybody. Dr. Rafich here from Vet Triage. We are continuing on with JAVMA, January 15, 2015, looking at the evaluation of the effects of hospital visit stress on physiological variables in dogs. Very cool topic, very common concern. This study comes out of the university in Colorado, as well as a hospital in Kansas, a hospital in Louisiana, and a hospital in Colorado as well. Objective: to evaluate differences in pulse rate, rectal temperature, respiratory rate, and systolic arterial blood pressure in dogs between the home and veterinary hospital environments. Prospective study, 30 dogs that were otherwise healthy. Results found that there were significant differences in blood pressure, rectal temperature, and pulse rate between measurements collected at home and the hospital environment. The mean blood pressure increased by 16%, rectal temperature increased by less than 1%, pulse rate increased by 11%. The number of dogs panting in the hospital, 63%, were significantly higher than those panting at home, 17%. There you go. And this, by the way, is why virtual medicine is so important, because even though you could argue, well, we can't check blood pressure in the home environment, heart rate or pulse rate might be difficult as well. Still, number one, owners could do that, and I think in the future we're going to be able to do that with pet owners. And number two, they can still check temperature and count the respirations, and even some people count pulse rate without machinery, without medical tools. And so virtual care can give you a more accurate assessment of these parameters while the animal's at home when compared to in a hospital setting. So this is very pro telehealth. Introduction: a critical factor in the analysis and decision-making process is whether elevations in vital signs are clinically important or whether they are artifacts caused by the patient being in a medical setting. In human medicine, a patient's blood pressure is higher at the doctor's office than at his or her home, a phenomenon known as the white coat effect. A 2008 study found that 60.3% of 224 human patients attending a lipid screening clinic experienced the white coat effect when their blood pressure was measured by a doctor during a clinic visit. In cats, a significant increase in blood pressure was demonstrated in a research colony of cats. Additional studies have found significant differences in pulse rate, respiratory rate, and indirectly measured blood pressure in cats. In dogs, significant increase in pulse rates measured at a clinic versus home, and a higher blood pressure at clinic versus home as well. Another study found no significant increase in blood pressure in dogs in the hospital compared with at home when measured by using Doppler technique of the right cranial tibial artery. Materials and methods. Blood pressure, we consider differences of over 10% to be clinically important. And if a dog was open mouth breathing with a rate of over 80 breaths per minute, but no evidence of dyspnea, that rate was recorded as panting. Pulse rate was recorded by palpating the femoral pulse for 15 seconds, multiplying it by 4 to get beats per minute. Rectal temperature was with a single digital thermometer. Systolic arterial blood pressure was obtained by indirect Doppler method. Animals placed in right lateral recumbency, restrained by the pet owner. Blood pressure cuffs were 40% of the circumference of the left forelimb distal to the elbow. The crystal was placed over the left median artery, immediately proximal to the metacarpal pad. They collected 3 consistent readings within 5 millimeters of mercury to each other. Transportation time was determined to be a minimum of 10 minutes and a maximum of 35 minutes. Results: dogs had a median age of 4.5 years, a median weight of 26.4 kilograms. Most common breed was mixed breed. Significant differences in blood pressure, rectal temperature, and pulse rate were observed between measurements taken at home and the hospital. Mean blood pressure increased by 16%. Median increase when in the clinic was 20.5 millimeters of mercury. Rectal temperature increased by less than 1%. Median increase when in the clinic was 0.2 degrees Celsius or 0.3 degrees Fahrenheit. Pulse rate increased by 11%. Median increase in the clinic was 10 beats per minute. Respiratory rate increased by less than 1%. Median increase in the clinic was 1 breath per minute, but the change was not significant. The number of dogs panting in the hospital environment, 63%, was significantly higher than home, 17%. Discussion. Significant increases in rectal temperature, pulse rate, and panting, and systolic arterial blood pressure observed in the hospital versus home. These likely stem from the activation of sympathetic nervous system, maybe exposure to new people, being in a new building, transportation excitement, restraint, scent and sight of different animals, anxiety associated with measurement process, or low-grade discomfort associated with rectal thermometer placement. The changes in documented systolic blood pressure between the home and hospital environment in dogs in the present study were considered clinically relevant, with a mean increase of 16%, and the highest individual increase of 68 millimeters of mercury, which is 57% increase. In humans, the white coat effect is a well-documented phenomenon, and similar effects have been reported in dogs and cats. It would be interesting to know if they did this in a certain order. So, for example, since we know that animals are going to be stressed out if you get a rectal temperature, it makes sense to do that measurement last and do the less stressful ones first. So, something like checking pulse rate first, checking breathing, respiratory rate second, and doing the blood pressure and then temperature, something like that, because that order could affect the changes. In fact, it'd be cool to have another study done where they compare not only these parameters, but also different orders that you collect these parameters to see if it changes. The mean elevation and pulse rate in the hospital environment was 11%, and that was significant. Changes of over 10% are considered clinically relevant. In contrast, mean elevations in rectal temperature of 0.15 degrees Celsius, which is less than 1%, and respiratory rate of 2 breaths per minute, which is less than 1%, fall within normal range and are unlikely to be clinically significant or clinically relevant. The highest recorded increase in pulse rate, respiratory rate, and temperature were 44 beats per minute, which is a 44% increase, 14 breaths per minute, which is 46% increase, and 1.06 degrees Celsius. Additionally, 3 dogs with rectal temperatures of less than 39.17 degrees Celsius or 102.5 degrees Fahrenheit in the home environment had temperatures of over 39.17 degrees Celsius in the hospital environment. In a similar study by the same group of this study evaluating cats, no significant increase in rectal temperature was found in the hospital versus home, a mean increase of 0.17 degrees Celsius or 0.3 degrees Fahrenheit. However, in both the study of cats and in this study of dogs, a few individual animals developed elevated rectal temperature purely as a result of transportation and the hospital setting. Panting is a normal variant of breathing, but differential diagnoses for unrelenting panting in the home or hospital include pain, anxiety, metabolic acidosis, and endocrinopathy. Panting has been correlated with increased salivary cortisol concentrations, representative of increased sympathomedullary adrenal axis activity in the hospital setting. However, if panting is severe or unrelenting and heat exposure has been ruled out, then an underlying disease should be considered. This study demonstrates that a significant increase in pulse rate, systolic arterial blood pressure, panting, and rectal temperature for healthy dogs examined in the home setting versus hospital setting. Yeah, I mean, this is so important. Obviously, we need studies, like I said, to have more animals and maybe even test the order of these parameters and the way these parameters are measured. But we get calls in vet triage all the time about animals that are panting and or shivering or whatever, just general kind of like non-specific signs, and we have to figure out, is it stress related for something in the environment or not? So for veterinarians, keep this stuff in mind. We are, as vets, pretty much familiar with white coat syndrome because animals that are normally not aggressive at home will be aggressive in the clinical setting, and of course if they're aggressive or fearful or whatever, that will make their temperature go up, heart rate go up, etc. And then for pet owners, realize that maybe periodically checking these parameters, if your pet allows it at home, and keeping a chart of what the trends are, that'll be valuable not only for a televeterinarian like vet triage, but also valuable to compare to the clinical setting with your veterinarian when you go see them in person. So very useful information. Keep that in mind. We'll see you guys again tomorrow. Bye-bye.